Hi there, welcome again to the Doctor Teacher, the channel in which we never stop learning. And my name is Mustafa Dönmez, internist, occupational health doctor and teacher. And we try to answer or talk about a medical subject every week, which we will try to explain simply to you. I want to also refer you to our YouTube Shorts feed, in which I answer random medical questions within a minute. So challenge me and ask me a medical question and I'll try to answer it within a minute. Okay, well, this week's topic is a topic which is very common, namely hypothyroidism. First, I'm going to focus on the symptoms. And I'm going to try to explain logically how you can find those symptoms if you know what the thyroid hormone does. Secondly, I will shortly talk about the way we diagnose hypothyroidism in the majority of cases. And thirdly, I will talk about the general causes of hypothyroidism. Okay, so the symptoms of hypothyroidism can be related to the effects of a thyroid hormone. Because what is hypothyroidism? Hypothyroidism is, of course, an underactive thyroid, or that your body has insufficient thyroid hormone. And thyroid hormone is a very important hormone in our bodies. It has very diverse effects, and the way I explain it to my patients is it mainly has effects on your metabolism. So if you have insufficient thyroid hormone, your metabolism works slower. And if you know that, then you can logically adhere to the complaints of a patient with hypothyroidism. Because the complaints of someone with an underactive thyroid are fatigue, hypothermia, so a lower body temperature, which is also logical if your metabolism is working slower. Because your metabolism is working slower, your gastrointestinal tract is working slower, and that's why patients can have constipation. Another complaint of hypothyroidism is gaining of weight, which is logical if you know that your metabolism is slower. Your pulse is your baseline pulse is slower in hypothyroidism, or can be slower, I should say. And some patients can also have depression or other mental problems when your metabolism is working slower. So if you know that, if you know metabolism is working slower, you'll know to ask to those complaints. And you'll also know what hyperthyroidism, an overactive thyroid, what complaints those patients have. Because they have usually the inverse. Those patients have hyperthermia, so their temperature is higher. They lose weight. They have diarrhea. So if you know that difference, that can be helpful in distinguishing between those two. Okay, so those were the symptoms explained. So how do we diagnose hypothyroidism? And we diagnose hypothyroidism with a few tools that we as doctors have. The most important still being the history of a patient, because if I ask about the complaints I just talked about and you have them all, then I will think of that disease. Of course, that's how we work. So your medical history, your physical examination can sometimes be helpful. And another way, and an important way, is by taking blood samples. And in the blood, we measure specifically your thyroid stimulating hormone. That's the hormone that's made from your brain and that stimulates your thyroid. So when your body doesn't have enough thyroid hormone, your brain should make more of that thyroid stimulating hormone, or TSH. So when your TSH value is elevated, that's a very clear sign, or an important sign, that you might have hypothyroidism. So that's a good screening method to test in your blood. So that's how we diagnose it. And then finally, what are the causes of hypothyroidism? Well, it's very broadly, I'm going to simplify it again. You can have a problem in the brain. So the hormones that should stimulate your thyroid are not being made by your brain, by your pituitary, for example. And that's one cause, but the majority of the causes are due to illnesses in your thyroid. Specifically, autoimmune diseases, in which case your thyroid is being attacked or even destroyed by an autoimmune disease, after which your thyroid cannot make enough thyroid hormone. The most common reason for that being Hashimoto's. So those are the basics of hypothyroidism. We talked about the symptoms. I tried to explain the symptoms. We've talked about the basics of diagnosis, and we've talked about the basic causes of hypothyroidism. I hope it was helpful, and if you have more questions, or if you want another subject of hypothyroidism being tackled by me, please leave a comment. And if you're really interested in our channel, subscribe. It really helps. Whatever the case, I hope to see you next time.